Recording in progress.
I, Dr. Sanjay Pandey, at the Kokilaben Dhirubhai Ambani Hospital in the Department of Urology at Andheri West in Mumbai. I'm keen to come back to you on a very important topic. The topic which is not usually discussed because it sometimes feels to us in the busy schedules that we run around that there's a possibility of not much health changes may happen and we are doing well. But remember, for all practical purposes, the body undergoes a change. The body is not a statue which you continue seeing at the crossroads every day when you take a traffic turn there. That statue looks as good as it was for generations. The body is a different structure altogether. But it's made in such a way that it grows, it matures, and all the organs continue to function optimally. At one point in time, from this great rise and then the stat plateau, and then finally a little bit of gradual disintegration or decay or decline in a function can happen. And there's something missed out in a busy schedule that we have. So let me talk to you regarding bringing health to the front row seat. Healthcare is a very important aspect of probably humanity, which is missed out in the aspects where progressive change happen very slowly. A lot of changes happen very slowly, which is deciphered by us, but because our body can probably take it, our body can probably postpone it, we miss out or we probably ignore it. And that's what happens. Let's look into the Department of Urology at the Kokilaben Dhirubhai Ambani Hospital, where in my office, when I'm sitting here, I talk to you regarding change in urinary health. So let's talk about men. Let's talk about men and prostate health. Prostate is a gland which many a times is not known as to where it is. So prostate is an internal gland, which is approximately 10 to 15 grams, like the shape of possibly a lemon, a walnut. It is lying just below the urinary bladder, and you know where the urinary bladder is. The urinary bladder is where you get a sensation when you want to pass urine at the lower part of your abdomen in the pelvis, where a bladder, which is otherwise an empty organ, will gradually fill up with urine coming from both the kidneys and fill up to a point in time where it gives you sensations, and then you go and pass urine. So the entire aspect of urinary health towards emptying the urine, which is being made by the kidneys, is your responsibility. The heart, the lungs, the brain, the kidneys are all responsible automatic organs which continue to do well in their life. They continue to generate what they need to, and for the kidneys, they continue to generate this waste product, which is kind of a solution called the urine, where there are solutes and solvents joined together. And this urine is produced in a very automatic way, depending on how much water to be kept back by the body and how much of water is to be given away is what the kidney produces as urine, which is a solution where a lot of solutes are mixed up in the amount of solvent that has been given to the body in terms of drinking water. So imagine how much of responsibility we have for our body, which perhaps we are not aware of, or possibly which has been missed out in the schedule that I said we run across every time in the life that we lead. So in cities, wherever we live in, we need to be aware that the body is undergoing a continuous change. So for the first 4 decades of life, 10s, 20s, 30s, and 40s, things may be very, very stable because the anatomy that we have of the body is awesome. It's wonderful. It's made such, I think the best computer ever made by anybody was by God. The body that was given to you is capable of growing from a seed to a tree, matures enough, gives flowers. You're capable of various aspects in your life. Therefore, give a lot of salute to what actually has been given to you as a body. A lot of times people say, I don't like this organ. Mine is short, mine is long. But at the end of it, you need to know this is a very shaped up kind of a body, which is capable of all the functions that you do from breathing to eating to walking and probably your muscles and bones. So coming back to urinary health and urological health, and this health is so important. At the Kokilaben Hospital in Andheri West, in the Department of Urology, when I sit across from 8:39 in the morning till late hours, I look at individuals coming in with diseases which actually are not known to them or has been treated, or perhaps has not got the right treatment, perhaps missed out or ignored. So we're looking at the prostate today, and men from their 40s, 50s undergo a change in the prostate. So prostate, a male organ, females don't have a prostate, is an organ which is just below the bladder neck. So when the bladder will open up to pass urine, there will be a prostate through which the urinary passage goes. And this urinary passage is obviously a narrow passage. You can look at the tip of your urinary system as a male, and you can know that that is the narrow tube, which actually is all the way inside from the level of bladder or bladder neck to the exterior, which is 18 to 20 centimeters of urethra. The first part of the urethra or the urethral tube is actually engulfed by this small organ called the prostate, which actually will undergo a hormone change. This hormone change will be slow, progressive, and over decades. It's believed that the hormone change, which brings about hyperplasia of the cells, because this is a hormone related gland, starts somewhere in late 30s, 40s, 50s, and we're not aware of it. It's deeply an internal gland. It's not our face where we can see and probably apply moisturizers and creams and shape it up. Prostate is completely a different organ altogether. An organ which undergoes its shaping up with changes in the hormones. And therefore, two kinds of changes can happen around. And let's discuss that a little later. But then the prostate is something through which the urinary passage passes. For example, the door is something through which we pass. So the door controls the passage. Similarly, prostate controls the passage, which already is gifted narrow to you as a male. Now, undergoing a change in the prostate are two some. One is what you can see, and one is what you cannot see. So let's discuss what you can see. What you can see is an ultrasonography, an observer-oriented investigation by a respected sonologist who actually does a sonography and measures the prostate size. It's measured as 3 dimensions, and from a 10, 15, 20 grams prostate in your younger age group, which is 20s and 30s, the prostate can undergo a progressive change to a size which could be 30s, 40s, 60s, 80s, 100s, 150, 200 grams, 300 grams prostate. So it can just grow. It just can grow around and can spread to any location. It can spread outside. What can be measured? It can spread inside the urinary bladder because it's at the neck of the urinary bladder. Or it could actually not even grow. So what you can see is what is the growth which is visible as a size that is measurable or measured by an individual, our respected colleague, a sonologist. And don't forget, it's a wonderfully but rough measurement. It's an approximate measurement. I sometimes say, if you do 5 sonographies in a day in 5 different centers, you may be confused a little bit because every time the sonography size may come different. So it's not a computer-gated study. It's an observer who is watching the whole aspect of dynamic and static organs. A static organ which has got this size, viewed from different sizes, could actually give an idea that it is enlarged to this size. So I've had patients who have done 5 sonographies in a month have got confused. In 5 different sonographies, the prostate size has gone up and down within a month, which is not true. So prostate size matters to a sonologist and to you on the other side of the consulting table. But for a urologist, there's another thing which matters. And that is what you cannot see. I said, what you can see is an enlarged prostate. And that's what probably people come for. They say the prostate is enlarged. My healthcare report shows my prostate is enlarging. That means last year was around 35. Now it is 42 grams. Somebody comes and says, my prostate is very big. Somebody says, my prostate is not so big, but I have got complaints. And I'm looking for that. As a urologist in this city, in this country, in this world, a urologist is interested in your urinary health to safeguard the urinary health. Yeah, you heard it right. It is not about having a urinary system which goes through a trouble. We are looking at safeguarding, and therefore, a positive channel which actually looks forward to promoting positive prostate health today is important for you to listen to the end. What happens here is, on one side, what you saw was an enlarged prostate is undergoing a change which is measured. Then there could be other changes happening. And one change could be that the prostate, while enlarging, can also be blocking the urinary passage internally. It can grow to whatever size that I mentioned, that the sonologist mentioned. But actually, it can also occlude a very narrow urinary passage. And that too doesn't happen in a day, week, month, or a year. It again is a very, very progressive change, extremely progressive change. It's a progressive change which not many of us can escape in our lifetime. And therefore, to have a friend as a urologist at your age group of 50s to your 80s is almost a requirement in whichever city you live in. A friend indeed who would help you out and pick up things earlier than you can pick up. I said missed out, ignored, and probably just looked at and waited till a trouble can happen is one way of living. The other way is to being aware. And therefore, you are tuned into a channel which talks about positivity in prostate health, and positivity is important. So let's look into that aspect too. Let me get into this. That what I am interested in as a urologist and all my colleagues in urology in this city and this country are interested in is what your urinary health. Do you pass urine with a good speed in your 50s, 60s, 70s, and 80s? But this starts late 40s around when the adenoma or the prostatic adenoma or there's a hyperplasia of the cells where the cells grow and therefore the growth of the gland happens. The urinary passage through it is gradually getting occluded. It's gradually getting occluded for one and all. So you name somebody in this country and city, and he may have some changes in his 50s, 60s, 70s, and 80s. But how do we measure? We don't measure because somebody is comfortable. The comfort level has come out of a progressive change, which is obviously slow and minuscule. If there's a change millimeter by millimeter by millimeter, you can't pick it up. So progressive change, which is so slow, in the background of a capability of beating the change, what does that happen? So a prostate gradually grows. Growth can be internal or growth can be external. The external growth is what is measured by your radiologist. But the internal growth, which is what I am interested in as a urologist, to safeguard somebody's urinary health and time, is the occlusion of the urinary passage, which will convert to a change in the urinary flow. So what's a change in the urinary flow? When we were in our 10s, 20s, 30s, and 40s, remember, we could go to the washroom and empty it in one go. Many of us could aim it onto the wall and could paint on the wall. That means the speed was awesome. We could finish in few seconds to maybe 15, 20, 30 seconds around. On the other side, as there's a progression gradually happening, obviously over decades, I said over years, the change happens where the urinary stream, which could be thrown all the way far, gradually slows down, and the slow is very, very slow. It is obviously a slow process of slowing down a urinary passage, which we can beat a lot mentally in this kind of a world we're living around, kind of schedules and the kind of focus that we had in our lifetime. Other side, there's a urinary bladder, which is an amazing organ. Urinary bladder has a capability of relaxing and contracting. And just imagine, the bladder which relaxes and lets you hold urine till you go to the washroom and empty your urine. The bladder has a capability also to contract and push urine out of an immense capability. Therefore, when the progression of change happens in the prostate, where the prostate is very slowly occluding the urinary passage, the bladder learns to get into action. It was into action all the time, contracting when you had a sensation, you would go to the washroom and open your zip and you would aim it in the toilet. The bladder would contract, the passage would open, urine would come out. And that was your life in your 10s, 20s, 30s, and 40s. But progressively, the changes happen where the prostate is gradually occluding the urinary passage and the passage is tighter. The urinary flow is not so great. The bladder now learns its internal signal. I said, body is an amazing computer. Each organ in its neighborhood gets to know what is happening around. And therefore, a friendly neighborhood, which actually is a part of the urinary system, that is a capability of ours in a conscious world, actually brings about the contraction of the urinary bladder and the passage opens up. So there's bladder contraction powers, which are strong powers in elastic kind of an organ that God gave you. The bladder's contraction power goes up, which is where a lot of men who actually had progressive obstructive urinary complaints now come for something else. They come and say, I've got a frequency of urination which is higher than before. I've got an urgency of urination which I can't control. It's almost like a precipitancy. Wherever I'm standing, I would almost leak urine, which is called as urge incontinence. So what do they develop? They develop a secondary overactivity in the urinary bladder. Secondary overactivity, secondary to an obstruction that you started knocking the door very heavily. So the bladder is now busy knocking open, which was open in the past, but now is gradually closing down. I busy knock this door to open up the door because the door is closed. So door is gradually closing down for everybody in his 60s, 70s, 80s, and 90s. And that's a great news. That means if something is happening, we are capable enough to get it sorted out. And that's where God made a urologist. And there were urologists in the city, in this country, and all my colleagues in the Urology Society of India and across look into asking you questions which we rate. We sometimes, for the reasons of rating you, do an IPSS symptom score, International Prostate Symptom Score, or ask you those questions in a layman's term. Do you pass urine with a good speed? Do you have a hesitancy? You take time to start. That's hesitancy. You hesitate to start because the bladder has to contract extra. Sometimes you may push it from your abdominal wall or tummy to push the bladder, which is not able to push beyond a point in time if it's a delayed presentation. Otherwise, uh, the obstruction is progressive. You strain and you have a narrow stream, and sometimes you leave the washroom without emptying urine, which means that the bladder is still full. You know, you can only empty this much. Maybe you may go a second time. So all these are obstructive urinary symptoms where you have a very narrow stream, a thin stream, a stream which is delayed, a stream which takes a long time to empty or a prolonged urination. At the end of it is incomplete emptying of urine, and you take some time to start, which was immediately before immediate start kind of thing. So that's called hesitancy. All these are obstructive urinary complaints as a result of progressive obstruction happening to the urinary passage. So that's one aspect. The other aspect I did talk about just now was secondary overactivity of the bladder, which is now learning to empty because it has to empty. And therefore, the bladder responsibility is to contract first, the passage open, urine comes out. This contraction now progressively gets a little more significant, and that's where your bothersome rises. So as a man, if anybody is having gross frequency of urination, urgency and can't control urine, or urge incontinence and would leak urine out, there's obviously some change happening which you and I are not aware. And that is secondary overactivity, which is secondary to an obstruction, which you and I have either ignored or have been able to surmount by our capability. So let's understand that this is an important aspect of care. And therefore, in prostate health, it is so important for us to be aware that we need to bring health to the front row seat, and more so urology health in prostate healthcare for all men. And therefore, anybody who has got time to empty urine, prolonged urination, time taken for the urination is too long, passes and drop, empties, stops and starts, does not empty the bladder fully, or otherwise a very narrow stream, are individuals who are having an obstruction to the flow of urine. On the other side are aspects of care where you are having a secondary, more bothersome complaint where you pass urine more frequently. You have to go again and again. You have to search your toilets everywhere. You have to map your toilets, pass urine, and somehow you have to empty the urine around. Not an easy thing. It's a challenge for you to search toilets, wear black pants, otherwise you would leak urine, and occasionally you leak urine. And that bothersome bring a lot of people to us at the Kokilabin hospital, where I get to see पिछले हफ्ते से 2-3 हफ्ते से for few weeks to few months I'm not able to control urine. Then I ask them, have you have an obstruction to the flow of urine? And many of them say no. Many of them say we have for a very long time. So I think it's a wake-up call. It's a wake-up call where we look into identifying and bringing urology health to the front row seat for all men who don't pass urine well, for all men who take time to empty urine, for all men who probably are taking time to come to a urologist because there's a urinary issue. I don't think there's any issue to probably postpone urination because you don't want a secondary overactivity of urgency, frequency, leakage of urine. And then you remember that this is an overactive bladder. So overactive bladder can be de novo overactive, or it can be made to be secondary overactive as a result of the obstruction that is developed at the level of the prostate. So friends, if you are taking a long time to pass urine, if you don't empty your bladder fully, if you have a very narrow stream, and if you feel like you take time to start urine while others in the public toilet have emptied urine, if you have a prostatic enlargement, which is measured on the ultrasound, or if you have secondary overactivity of increased frequency, urgency, and urge incontinence, and you are in your 50s to 80s, which happens to so many men who are not aware of this, this is an important session for you to wake up and understand that this is treatable. This is curable, because what is there today will not be tomorrow. There will be a progression of change. So if you're in your 50s, 60s, 70s, and 80s, and you're taking medicines for prostate issues, for which you also don't know, it's time to probably see your urologist. It's time to see your urologist if the medicines are not acting, the flow is not getting better, control is not coming, you're passing in drops. It is time to take urology health to your urologist and complain. See your urologist rather than doing health checkups and measuring your prostate size and kidney size, and sadly kidney stone size, which probably gets postponed till an emergency. So a wake-up call. Humbly, this is an important message to all of us who are in our 50s to 80s, that if you have a urinary health issue which could be anything, burning sensation, bleeding in urine, burning sensation along the urinary passage, pain in the region of the bladder, not able to pass urine well, emptying only a little bit but not completely, passing again and again, and obviously nocturia or getting up multiple times at night and don't know whom to go, see your urologist in your city. That many people come from different cities, having undergone a treatment, having been treated for prostate and urinary health and urinary infection. It is important for us to wake up all men in this country. And therefore, bringing about positivity on your channel and looking at waking you up that if you have urinary health, it could be you, your elder brother, and your father. It could be somebody in the neighborhood or your uncle, or it could be you who probably has beaten up all this by a strong kind of a capability that you have. Your bladder is still very strong and contracting. Possibly you are so busy that you probably are not aware of a change which is progressive, and it's only brought about by ultrasound, brought about by something. We normally look at it by calling you and doing a uroflowmetry. If I need to know your heart, I would do an ECG. I know all about your heart. Similarly, if you want to know your prostate health and what does the prostate size mean internally to me, I would always ask you to do a uroflowmetry, where you pass urine in and toilet attached to a computer. And the kind of flow pattern tells me all about you. Like a pattern of the ECG tells all about your heart to a cardiologist. And then whether you go left or right, a lot depends on your ECG. Similarly, a uroflowmetry or your flow of urine through a progressively occlusive urinary passage is what will bring about a change. So friends, it's time to bring health to the front row seat. The front row seat where if there's a urinary health, we don't postpone. We go and see our urologist. We walk in. Perhaps a lot of people come to me and complain that we have a waiting time attached, but you were waiting for a long time. And out here, over the 12 to 15 hours of work, we probably take a history, examine you, define a therapy, explain to you and counsel you before we send you back home, hoping that you are safe after all this and the right medications for a follow-up. And therefore, if you have a waiting time, please don't mind. It is a waiting time towards improvement, towards betterment, because all the time we have in the world is possibly for our health from now on. So if you are in your 50s to 80s, friends, bringing health to the front row seat in your neurology, in your cardiac care, in your various aspects is important. But a progressive change, which is not known to many of you, is a male prostate change, a prostate change which undergoes so many things. On an average, while I talk about all this in the same clinic, by an examination, by looking at your PSA, by looking at the aspects of changes happening, I pick up cancer prostates by digital rectal examination. Not that they are referred to me, many of them are picked up here on routine examination. So after 50s, we also need to do an annual PSA test, prostate specific antigen. It's an annual test. And if somebody's elder brother or father had a cancer prostate, then he is on a radar for a possible close look that he is possibly an individual who could develop a prostate cancer in his lifetime. Friends, prostate cancer is another story altogether. So to bring prostate health into front row seat, you need to see a urologist. At the Kokilaben Hospital in Dheri West in Mumbai, over the last 16 years that I've been here, I look forward to helping individuals out to understand the subject, which is what we spoke in a short, crisp video for you to take it forward. On the other side, individuals who are taking medicines and probably getting treated and don't know much about their health, and the prostate is undergoing a change in terms of change in size, or the urinary flow has not improved. They're passing still urine with a poor flow and still taking a medicine. They need to see us. They need to see a urologist. We need to look at why have you not improved? Is prostate to blame for all the urinary reasons? Or sometimes the bladder is to blame. That means the bladder is not contracting. That also needs to be picked up. So bladder not contracting could be because of long-standing diabetes, spinal diseases, neurological diseases, or possibly just age-related changes happening as a result of graceful aging. So as we gracefully age, we refuse to age. And let's refuse to age by probably bringing our health to the front row seat. Friends, it is important for you to watch these videos to probably understand what I continue to speak across the consult table to many patients around. Thank you so much. Prostate health in terms of its enlargement, occlusion, and prostate cancer care, all under one roof at the Kokilaben Hospital in the Department of Urology. And I, Dr. Sanjay Pandey, heading the Department of Urology, would like to look at each of these aspects of care which I've done for the last 25 years in my career in urology. Thank you so much for listening to this. Thank you so much for subscribing, and thank you so much for taking care of yourself and therefore your family, therefore your future. Just taking medicines without knowledge, just taking medicines without knowing, all belonging to the same family, which is chosen by your urologist, just taking medicines will not help everybody, because a part of the individual subset who probably don't realize that their medications may not work would require a cure beyond a treatment. And that cure could be by probably operating the prostate, cleaning the passage, and getting a flow which was there in the childhood, which a lot of people say, I never passed urine like this since my childhood, Dr. Pandey. Thank you so much for operating me. So whom to operate, whom to give medication, whom to pick up a disease early and late is probably a purview of a urologist. And that's what, in long hours of work, sadly, that we have made people wait around while we consult, while we operate, while we talk and take emergencies and non-stop work. Over the last 16 hours, we follow the motto, every life matters, at the Kokilaben Dhirubhai Ambani Hospital. And today, to improve the quality of life, that every quality of life matters, we look forward to meeting you again and again, safeguarding your health. And there are individuals who have been treated for 8 to 15 years in this hospital and done completely well. People have come from different parts of the world, different parts of the country, and probably have got their health lined up, the urology health lined up. It could be everything from genital health, from andrology, from sexual issues that they go through and don't know whom to speak to, because at the end, the urology and andrology care, which is what we look forward to, from infertility to nocturia to penile processes to erectile dysfunction to prostate cancer to bladder health and to overactive bladder, both in men and women. Both in men and women. Women do develop urinary issues sans prostate. They don't have a prostate, but they develop everything. And we see equal number of women and men. Women need to see a urologist. Many of men go to gynecologists who are already busy with so much of ovaries and uterine work, and probably urinary health is to be safeguarded by seeing a urologist in your towns and cities. So friends, as I sign off today on another working day here and get back to starting my day at 8:30 in the morning, I give you a complete overall aspect of urological health, which is a lot of time shame, a lot of time not spoken around. We are ashamed to speak about urinary health, about urinary system, till one fine day it becomes so significant. And we examine everybody and take it to the next level. So welcome home. Welcome to our Department of Urology. Welcome to see me. Welcome to help you out, come out of this medal completely and give you another new direction to urinary health where you're comfortable, where you're safe. As a male, you should not develop a urinary tract infection. If there's a UTI developing in a male, then obviously we need to know why. Is there a phimosis or a skin completely tight? Or there's a stricture of urethra or a blockage in the urinary passage? Or the prostate is occlusive or blocking the urinary pipe by the level of the bladder neck? Or the bladder itself is very hypotonic and does not contract? Why on earth, if a male is great hygiene, has no diabetes, has no phimosis, no stricture urethra, and the prostate is non-occlusive, forget the size, and finally the bladder is contracting well in his 40s to 80s, at all get a urinary infection? It's not a female. Females get urinary infection sadly by the way of the anatomy and requirements in the anatomy, which is changing progressively with age from menarche to menopause and beyond. So women's urinary health and women's UTI is something which I take care of and prevent them from getting recurrent UTIs, antibiotics by looking at the right approach to the right individual. But out here today that we talked about men, I wish every man who is in his 50s listens to this twice, gets to understand that urinary health is to be safeguarded by a urologist. At the Kokilaven Hospital, that we have an online consult which can be seen from the hospital website online consultation. We get to see people who actually have seen the YouTube and said, we heard you speak about our disease. I said, no, I spoke about humanity. I spoke about positivity, about something which is changing. Let's not make it a disease. Let's pick it up in time. Let's probably treat it and cure it. So friends, from a Department of Urology in my office at the Kokilaben Hospital, I, Dr. Sanjay Pandey, sign off again, looking at positives in prostate health, which probably can only be brought about when we combine together. So we is stronger than I. And finally, if you always do what you always did, you will always get what you always got. In other words, if you continue taking medicines without evaluation, without examination, things may change. Things may change in terms of not betterment, because the progression of change is towards, I said in the beginning, a gradual decline, a gradual decay, a gradual disintegration. We need to safeguard us. And therefore, after 50s, it's nice to consult a urologist once a year to look at the PSA levels. They pick up early. This week was an amazing week. 7 cancer prostates, of which 6 were localized, underwent a radical robotic prostatectomy, where we, with a robotic approach, went in and I cleared the prostate cancer completely along with the nodes. One gentleman had come with a very advanced prostate cancer with a PSA of 659, where the prostate cancer had spread all across. All that we did was, because he was obstructed and there was a urinary passage completely blocked, we gave him a good channel TURP. We started him on hormone therapies, a bilateral orchectomy, and lo and behold, things are changing for him. His urinary catheter is out. He's passing urine like a child again. And because the disease, which is a hormone-related disease, has been spread, a hormone therapy is probably taking care of him, which the PSA will gradually fall down. We'll share that message with you. And therefore, it's never late than ever. That means you've undergone a treatment and you've not got a full result. You're still welcome to see us and probably take this care to the next level completely. And it could be in any city, anywhere around that this therapy is being done. It's all about the passion that we take forward to treat men for their sexual problems, for their urinary problems, for their cancer changes is what defines a urologist. Thank you so much.